Before collecting a sterile specimen from an indwelling urinary catheter, check the specimen container labels and, if necessary, complete the lab requisition. After performing hand hygiene and ensuring privacy, introduce yourself to the patient.
Good morning.
Good morning.
How are you today?
Not too bad.
Good. My name's Jessica. I'm going to be your nurse, okay?
Okay.
Can I see your wristband?
Then identify him using 2 identifiers.
Kent Zimmerman, 8445.
Very good. Okay. What we're going to do this morning is take a urine sample, okay?
Okay.
I'm going to take it right from the tube that's in your bladder. It shouldn't cause any discomfort.
Can't you take it out of the bag?
Can't take it from the bag because it won't be a sterile sample. We have to take it right from the tube.
Okay.
Okay?
All right.
Explain to the patient that you'll be using a syringe to draw urine through the catheter port. Reassure him that it won't hurt. Explain why the specimen can't be obtained from the drainage bag. Tell him that you'll need to clamp the catheter for 10 to 15 minutes before obtaining the specimen. Put on clean gloves. Place a clamp below the sampling port or fold the tubing and secure it with a rubber band.
And that's all. I'll be back in 15 minutes, okay?
Okay, thank you.
You're welcome.
Return to the room in 10 or 15 minutes. Perform hand hygiene and apply clean gloves. Position the patient so that the built-in catheter sampling port is easily accessible. This port is located at the point where the catheter attaches to the drainage bag tube. Clean the port for 15 seconds with a disinfectant swab and allow it to dry. Attach a 20 milliliter needleless luer lock syringe to the sampling port. For some needleless ports, a blunt plastic valve or slip-tip syringe must be inserted into the diaphragm of the port. Withdraw 20 milliliters of urine for routine urinalysis or 3 milliliters for a culture. Transfer the urine from the syringe into a clean container for routine studies or to a sterile container if a culture has been ordered. Put the lid on the sample and apply the label on the container itself, not on the lid. Prepare the specimen for the lab per agency policy. Unclamp the catheter to allow the urine to flow into the drainage bag. Make sure it flows freely. Dispose of all soiled supplies. And send the specimen to the lab within 20 minutes. Refrigerate the specimen if a delay is unavoidable.
Back in front of you here.
All done?
Is there anything else I can do for you?
No, don't think so.
Okay, your call light's right here. You just let me know if you need anything, all right?
Okay, all right, thank you.
Okay.
Remove your gloves and perform hand hygiene. As part of your follow-up care, review the patient's test results and report any significant abnormalities to the healthcare provider.